This is Hazel, a student nurse. In this video, I'm going to demonstrate how to perform a musculoskeletal system assessment. Now, before you do a musculoskeletal system assessment, you'll want to provide privacy for the patient. Do your hand hygiene and explain to the patient what you'll be doing. So let's get started. Good morning, I'm Hazel, your student nurse. How are you today?
I'm doing good, thank you.
That's great to know. May I have your name and date of birth, please?
I am Jamie Lynn Bicalco, born on December 14, 2003.
Okay, before we start the examination, I'll just have to ask you some questions. Have you had any recent weight gain?
No,
Do you have past problems or injuries to your joints, muscles, or bones?
no,
Do you have family history of rheumatoid arthritis, gout, or osteoporosis?
none,
Do you smoke? Do you drink alcohol or caffeinated beverages?
no.
Alright, let's proceed now to the examination. But before we do that, I would like to explain to you that I will have to frequently ask you to change positions and to move your various body parts against resistance and gravity. Is that okay with you?
Yes,
So the first thing that we need to do is to observe the client's gait. So I already done that. When she enters and walks around the room, her weight is evenly distributed. She can stand on her heels and toes. Her toes point straight ahead and equal on both sides. She also has an erect posture. Her movements are coordinated and rhythmic. Her arms swing in opposition and stride length are appropriate. So the next thing we gonna do is to inspect and palpate the temporal mandibular joint. And I'm gonna put my index and middle fingers just anterior to the external ear opening. And ma'am, I would like you to open your mouth and then kind of stick your chin out and in and side to side. Alright, and what I'm palpating for is any clicking or crepitation. Do you feel any clicking or anything abnormal with that? Any pain with doing that?
no,
Alright, so for each joint, I'm inspecting anything abnormal like redness, swelling, masses, and I'm palpating for anything abnormal as well as like clicking or crepitus. And then I'm going to test the range of motion. I'm gonna have you open your mouth again. And I'm gonna move your jaw laterally against my resistance. Alright, and then I'm gonna have you to clench your teeth. And what I'm feeling for is the contraction of the temporal and masseter muscles to test the integrity of cranial nerve 5, the trigeminal nerve. Do you feel any pain?
no,
Alright, good. So the client jaw has full range of motion against resistance. And I also palpated the contraction with no pain or spasms. Now with the client sitting, I'm gonna inspecting the sternoclavicular joint and I see that there is no visible of bony overgrowth, no swelling or redness. And as I am palpating it, there is no tenderness. Do you feel any pain?
no.
Okay, good. Next, we're gonna move on to the spine. First, I'm gonna have you ma'am to stand erect and I'm observing the cervical, thoracic, and lumbar curves from the side and then from behind. Okay, the cervical and lumbar spines are concave and thoracic spine is convex. So that's normal and the spine is straight when observed from behind. Then I'm going to palpate the spinous process and I'm gonna have you ma'am to turn around and then just put your chin to your chest for me for a second. And I'm just going to palpate the spinous process in the neck all the way down to the C7, which is very prominent, it's very easy to know, and then all the way down. Do you feel any pain?
No.
Next, I'm gonna have to check the range of motion of your cervical spine. So, I'm gonna have you, ma'am, to put your chin to your chest and look back up at the ceiling. Then turn your head side to side and put your ear to your shoulder. Okay, good. And then next, I'm gonna have you, ma'am, to bend forward and touch your toes for me to test the range of motion of your lumbar spine. Okay, that's good. The lumbar concavity flattens out and the spinal processes are in alignment. And then put your hands on your hips and bend side to side. Alright, and then without moving your hips, I'm gonna hold your hips. Can you turn that way? And the other way? Alright, good job. Now let's move on to the shoulders. I'm gonna have you, ma'am, to stand up for this. So for your shoulder assessment, I want you to go sideways like this. Lift your hands all the way up and put them behind your head. Okay, good. And all the way down. Alright, and then I want you to swing them this way all the way up. And then all the way back. And put them behind your back. Okay, good. Then just relax. And then lift your shoulders up against my resistance. Okay, that feels nice and strong. And now I'm gonna have to palpate the shoulders. And I'm palpating for anything abnormal. Do you feel any pain or tenderness?
No.
Okay, now I'm moving down to the elbows. I can see that your elbows are symmetric without deformities, redness, or swelling. And then I'm gonna have to palpate it. I do not see and feel anything abnormal here. It is non-tender and without nodules. Then I'm gonna test for the range of motion. To do that, I'm gonna have you bend your elbows up and put them straight. And then hold them out like this and turn over again. Alright, then I'm going to check the strength of your elbows. Pull towards yourself. Okay, good. And then pull hard with this one. So that's good. So your range of motion and your strength in your elbows are normal. Now we're moving down to the wrists. And as I inspecting it, your wrists are symmetric without redness or swelling. And now I'm gonna palpate it. And I don't feel any tenderness and they are free of lesions. And then I'm gonna have you perform the squeeze test and tell me if you feel any pain, okay?
Okay.
So the client tolerates test without extreme pain. So that's good. Next, I'm gonna test the range of motion of your wrist. So I'm gonna have you to put your hands out like this. And I want you to put your wrist down and your wrist back up. And to test for the range of motion of your hands and fingers, have your fingers are spread apart and put your fingers back together and then put your hands out straight. And just fingers down and up. Alright, and then put your hands over and bend your fingers. And I'm just checking the strength of your fingers. So good. And then to the other side. And I'm going to do over here too, to check the strength of your fingers. Okay, good. Then I'm also going to palpate. This is very important with palpating the hand because there are tremendous number of bones here, so you want to really do a good job of palpating all of these joints all the way down the fingers. So I do not feel anything enlarged, no swelling or deformities. The hands and fingers are symmetric, non-tender, and without nodules. Alright, now we're going to move on to your hips. And as I inspecting it, your buttocks are equally sized, iliac crests are symmetric in height, and hips are stable. Then we're gonna have you to lay back here. And then what I'm gonna do first is to palpate here on the sides where your hips are. Any pain with that?
No.
Any problems with your hips?
No.
Okay, so with this leg, I want you to move it out this way as far as you can. There you go, and then back in. And then I want you to lift it up and down. And then I want you to bend at the knee and lift it up as far as you can. Okay, and come in and then also come out. Good, and down. And then I want you to move your leg out against my hands. Push against my hands. Okay, good. And then pull against my hands. Okay, that's good. And then we're gonna do the same thing to the other leg. Move it out as far as you can and back in. Good. And then up as far as you can and down. And then bend your knee and come up and come in and out as far as you can. Okay, good. And down. And then pull your leg out against my hands. Good. And push in. Okay, good. Alright, I'm going to actually skip the knees for right now, and I'm going to move down to your feet because you have your feet up here where I can see them. And I'm going to palpate it with the feet and the ankles. There are a lot of bones in the feet and ankles, so you want to do a good job of palpating all those little bones in the feet all the way down to the toes. Same thing both feet, make sure that you palpate all those bones. Alright, and then can you push against my hands? Good, and pull up against my hands. Alright, good. And then I want you to put your toes together like that. And can you put them back out like this? And then can you put your feet together like this? And can you pull them out? And then can you put them out this way at all like this? Okay, alright. Now let's have you sit up, and then we're actually going to go back at your knees. At this point, I'm going to palpate your knees. This tends to be a problem area for people sometimes. Any problems with your knees?
No.
Any pain when you walk?
No.
Okay, can you straighten your legs out? And can you bend them? Alright, so push against my hands. Good, and pull against my hands. Okay, good. I'm gonna do the same thing to the other one. Push against my hands and pull. Alright, good. Then I'm gonna have you to stand up and put your leg out straight. As straight as it will go, and then bend your knee up as far as it will go. And do the same thing to the other one. So that concludes the assessment of the musculoskeletal system. Now I'll perform proper hand hygiene, and also if there are any signs of abnormalities, we want to refer them to other healthcare provider for further evaluation. And don't forget to document all the findings to the client's record. After that, we are now done for the assessment.